So a brief insight into how physio works for the practitioner now. So physios work in multiple ways. We have manual therapy techniques which we employ, and we also couple that with exercise prescription. So that covers a whole broad spectrum, I know, but some of the specialty fields that attune that we work from is we often work off a kinetic control model, which is looking at movement analysis, looking at pathology of movement, and then actually prescribing specific exercise regimes for that pathology. So that tapers in really well with our osteo friends. Hello if you're a new osteo starting. So we love your super manual skills. So often in acute stages, then you often get the patient to the point where their pain is under control, and then often from the integrative side, you guys will often palm off to us to maximise the rehab potential via an exercise prescription. And obviously it works two ways. Often we get stuck with some of our manual therapy stuff and we need a little bit of a different take on things, and we will forward that on to you. I think particularly the areas that I forward on are the SIJ and some of my trickier thoracic, especially CT junction things. Obviously each of the physios has their own specialty niches and areas that they're more comfortable treating, but as a general rule, probably the thing which puts us above and beyond some of the other practitioners with regard to management is really looking at analysing movement and trying to shape the program according to the faults that we see in movement. And the other ways we interact are obviously when the patient is needing some more ongoing care or some maintenance type work, then we really feel that the massage therapist can fill that role, and so they may not need direct technical advice, but they just need a little bit of a tune-up, and we'll often send them to the massage guys to save us some workload. There'll be times when, of course, we pick up on other things, other more specific psychological things, or aspects of nutrition and dietetics that we'll refer on, and we're more than happy to pick your brain, the dietetics guys and the naturopath guys, because that's a whole realm that, whilst it has impacts on the physio side of the business, that we don't have specialty areas in, and we love to hand them off to you. So we look forward to working with you in the future. So the specialty services that Physio at Attune tailors to are many, and I'll just work through the list. And if you have any questions as you go along and you want to grab me in the corridor, you can, but I'll try and make it as comprehensive as we can. So physios, of course, cover sports injury management. So we look at diagnosing and assessing sporting injuries, and then tailoring the treatment according to that injury. The other things that we do, we look at post-surgical rehab. So that can be anyone from someone that's had, say, like a total knee replacement, total hip replacement, spinal surgeries, and a whole range of specialty shoulder surgeries as well. Pretty much anything that goes to surgery from an orthopaedic perspective, we treat. The only things that we don't treat, which come from our orthopaedic surgeon friends, are probably some specialist hand conditions, but when you get those, it's probably better to ask me, and normally we refer those up to the John Hunter or to a private hand specialist. We do ergonomic workplace assessments, and that's just a fancy way of saying we go into someone's workplace and have a look at their environment and look at ways of optimizing that environment by making sure that the client has optimal posture when they're at their workstation. And sometimes what we'll do is provide various devices and implement things like standing desks. So that's headed up by one of our physios, Lynn McAtamaney, who you can have a chat with. We also do work-related activity programs. So this is where we look at someone who's been injured in the workplace and provide both manual therapy but also a specific exercise regime to get that person back to work earlier. Physio also offers a rehab service for patients who are going through oncology services, and our job as physios is that we help them maintain their exercise regime and try and maintain their activity levels while they're undergoing their care for their cancer. This helps them maintain their weight and muscle power, so that the effects of the chemo aren't as drastic on their body. So with regard to specialty care, each of the physios have a certain area of specialty that they look after, and what I'll do is I'll provide a list of the current staff members and the areas of niches that they work into. So if you familiarise yourself with each of the physios and what they look after, then you'll be able to better channel the patient so they get optimal care. We also do management for dizziness, so certain types of vertigo we look after, so particularly a condition called benign postural vertigo, which is something you might get referred from the GP, so we do specialty exercises for this type of clientele. We run a hydrotherapy service where people work out of Valentine Pool, and once the new clinic is built at Cardiff, we'll also do hydrotherapy sessions out of there. We have a specialised hydrotherapist who looks after that side. We have physios here at Attune that specialise in men and women's health, so pre and post maternity care, as well as things like pelvic floor retraining. There's a full casting service here at Attune, so we provide the plaster of Paris casting, so that's for arms and legs and hips. We also provide the synthetic casting, which we also do waterproof casting for people who want that. We also do bracing and taping. One of the other services that we do is provide cardiorespiratory care, so we look after people who have, say, asthma or COPD or chronic airflow limitations, and we maximise their lung function. Also, we treat people with cystic fibrosis. So things we don't look after, so there's not many things that we don't look after in physio, but probably the main ones that will come across reception are people who are looking for care after they've had strokes or head injury. We tend to refer them onto the John Hunter or some of the brain injury units. Physios currently don't look after paediatrics under the age of 5 unless it's for fracture management with regard to casting. I would refer you on to our osteo friends who will gladly look after the kids, and if it's something specialised where the osteos don't look after them, it would be best that you then refer them on to the John Hunter Paediatric Clinic, which is quite easy to get into and is a free service. But the best thing to do would probably be ask one of the physios whether we would look after that, or whether the osteos would look after that, and if we don't, then usually it's up to the John or to one of the private paediatric physios. So one of the common questions that we get at reception are whether we do post-op care for people with lymphedema, and that's a specialty massage service that both physio and massage here currently don't do. That's better referred to the Mater or one of the private lymphedema massage. Physio doesn't deal with is TMJ problems, so jaw problems. So fortunately, some of the osteos, Josh and Simon, will look after that. So you can refer those clients there, and if you also need some physios outside Attune to work on certain things, we can organise that. But generally, we get called into those patients for postural care and exercise regimes, which we're happy to do. But the actual manual therapy gets done by the osteopath. And the final area that we wouldn't go near is some of the specialty hand surgical rehab patients. But the best thing to do is if you have a referral for a hand hand patient that's post-surgery is just to come and ask me, I'll be able to, or Michael Corrigan, and he'll be able to tell you whether or not we'll take that on board. All the basic things like carpal tunnel, things like the Quervain syndrome, osteoarthritis, we'll deal with all those sort of conditions, but post-tendon repairs and things like that is better done by some specialty care. So just ask me and I'll refer you on. If you're ever in doubt and you need to work out what physio sees or doesn't see and you're not sure, just contact myself or Michael Corrigan. And if we're not around, then any of the physios should be able to point you in the right direction with regard to how to care for a particular patient. So one of the other areas that can cause issues for reception when they first start is because we are a multidisciplinary practice and we have the osteos and the physios and the massage therapists all dealing with some of the musculoskeletal injuries, is who should the patient see. And I think as you go on and you get to know each of the practitioners, then you know who deals with what and has their specialties. But for the general patient who's wanting to make an appointment and you're not sure, of course you can ask the patient if they have a preference. But remember that all the osteos and the physios can treat over a broad range of musculoskeletal injuries, and we're quite comfortable doing that. So we have many ways of treating, and our treatment ways vary, but often we end up with the end goal of getting the patient better. So you can give the patient an appointment, and the osteo or the physio will be able to determine later whether that person needs other type of care. So, and often we work together anyway to find a common solution for the patient.